Hello, my name is David Edelman, and I am the Program Director of the Detroit Medical Center Wayne State University School of Medicine Surgical Residency Program. Thank you for reviewing our slides. The leadership of our department begins with our chairman, Dr. Weaver, who went to medical school at Loma Linda University and then did his general surgery training at Wayne State University, for which he has remained on. He has been our chairman for the past 17 years. He is a general and oncologic surgeon. This is a photo of myself. I am the program director. I've been the program director for the past 5 years. I did my undergrad, my medical school, and my residency training here, and then I've remained on as a member of Harper D, or the MIS division. My surgical practice consists of minimally invasive surgery, robotic surgery, and bariatric surgery. We have 2 associate program directors. First is Dr. Samantha Terrace. She also attended Wayne State University School of Medicine and did her residency with us afterwards. She is currently the director of the ICUs at Harper and the adult central campus. Her practice consists of general and trauma surgery. Our second associate program director is Dr. Michael White. He also attended Wayne State University School of Medicine as well as our residency program. He is currently the burn director of our Level 1 burn center at Detroit Receiving Hospital. This is a map of showing where the residency exists, and you can see that Harper Hospital is here in the center. With Harper Hospital very close, you'll have the Detroit Wayne State University School of Medicine, you have the VA, you have Children's Hospital, and you have Detroit Receiving Hospital. I'm now going to briefly show you what some of the hospitals look like. The Detroit Medical Center is comprised of Harper Hospital, Karmanos Cancer Center, Detroit Receiving Hospital, University Health Center, Children's Hospital, as well as Sinai Grace Hospital. So this is a Harper Hospital. This is the front of Harper Hospital. The Women's Hutzel Hospital is also a component of Harper. And in reality, the Karmanos Center is also in Harper Hospital. Although on paper they are 2 separate hospitals, in reality they have many shared resources. Detroit Receiving Hospital is attached to Harper Hospital and it's connected by a tunnel. This is our Level 1 Trauma Center, where you'll receive much of your acute care surgery experience, trauma surgery experience, burn surgery experience, and some of your ICU experience. This is a photograph of Children's Hospital. It is a freestanding children's hospital that has all the services necessary. They don't send their patients out anywhere. This is also connected to the DMC via tunnels and is close on. The DMC Sinai Grace Hospital is approximately a 10-minute drive away from the adult central campus, but it is also a DMC facility and has a very significant trauma and acute care surgery experience. So when you're at our residency, these are the places where you'll rotate. You'll rotate through the Detroit medical hospitals, including Harper, Receiving, Grace, Karmanos, and Children's. We are also the only residents at the Detroit VA. You'll also spend time at St. Mary's Livonia, where you'll get a community experience, and you have a small experience to do an elective, which most residents choose to do in Muskegon of Northern Michigan. So I believe in complete transparency. So this is a demographic of our residents. What you can see is that we are approved for 8 categorical residents per year. So 8 times 5 gets us to 40. We're also approved for 12 preliminary PGY1 residents and 2 preliminary PGY2 residents. So we are approved for 54 positions. What you're going to see on the right side is the actual composition. We currently have 6 PGY5s, 6 PGY4s, 8 PGY3s, 9 PGY2s, 7 categorical PGY1s, and 10 preliminary PGY1s with 2 residents in research. And you might ask yourself, well, how come these numbers don't line up? And the reason is that we allow flexibility in our scheduling. Once you've completed your first 2 clinical years with us, we allow you to go off and spend time doing research or a critical care year. We don't mandate it, we don't require it, and some residents choose to do it and some don't. So because we allow that flexibility, the number of residents each year varies, and that's how we end up with the schedule on the right as opposed to what we're approved for on the left. However, we are ACGME compliant because we do not go over the number of residents per year or in the program. So when you start with us as a PGY1, this is what your typical year will look like. We've made our rotations 28 days long, so you will have 13 28-day blocks. We do this so that way it's very easy to know when you have your days off. You get 1 day off every 7 days. You get 4 days off per rotation. During your PGY1 year, you will spend time in all of our hospitals on all of the services. This will allow to the development of a good base experience so that you can continue to grow throughout your. This is what last year's chief residents had for numbers, just so you can see them. You can see that they graduated with an average of 985 cases. They completed an average of 265 chief cases, and they logged an average of 43 teaching assistant cases. And you can see that this is well above the expected normals for graduation. This slide draws attention to our American Board of Surgery pass rate. It should be noted now that they are recorded in a 3-year cycle. So this is our data that was reported in 2021. The 3-year first attempt rate, we had 28 individuals attempt the qualifying exam and for the first time, and 25 of the 28 passed for an 89% qualifying exam pass rate. The certifying exam during the same reporting period, we had 26 people attempt the qualifying exam, 21 passed on their first time, so a total of 81% first time certifying exam board passage rate. There's no longer combined qualifying and certifying exam board rates posted. Also of note, we had 6 graduates, and 5 of the 6 graduates passed on their first attempt. Okay, a brief moment about our education. We have a lot of structured education that is built into our residency program. We have a simulation program for all of our first-year residents. This is a 16-week course. It goes over 4 months where you have a dedicated 4-hour block each week to go over a simulation. There is a topic of the week, which may include endoscopic skills, laparoscopic skills, open skills, ultrasound skills. SCORE curriculum, we subscribe all the residents to SCORE. This is this week in SCORE questions. This is the National American Board of Surgery curriculum that we purchased for you so you can follow along. There's also weekly questions associated with it. There's a local collaborative that has basic science lecture series, which are all available online for you to follow. We have both basic and ultrasound courses that we teach in our residency program. We are only one of 2 FES and FLS testing centers in the state of Michigan. We have a dedicated 3-hour didactic every week on Wednesday mornings from 7 to 10 a.m. From 7 to 8 a.m. is M&M, 8 to 9 a.m. is Grand Rounds, and from 9 to 10 a.m. is a resident-driven SCORE talk that is included in your protective time. There are also review sessions that Dr. Mustafa performs on Monday, Tuesday, and Fridays. There are individual conferences both at Harper, the VA, as well as the DRH that are on top of the system-wide didactics that occur on Wednesdays. And residents participate in mock orals during their PGY3, PGY4, and PGY5 year. Again, this is an overview of the simulation training that you'll receive during your first 16 weeks as a resident. The Department of Surgery also has an application that we've developed internally. If you go on to the Apple Store or the Android Store and you search WSU Surgery, you'll see the application. This application allows you to have the call schedules, everyone's phone number, and a way of communication directly on your phone. This is another view of what it may look like. And we've occasionally done evaluations through it as well. This is a picture of the Da Vinci robot. This is just for me to remind you, to tell you that we have an extensive robotic experience. There are multiple Da Vincis in most of our buildings. Every building has at least one robot, and the robot now is becoming more of a general component of general surgery training. We have a separate robotics curriculum that also occurs. This is a list of the 2021 graduates and where they went. Again, I post this because I believe in complete transparency. As you scroll through this list, you'll see that several residents have gone into MIS fellowship. MIS fellowships have become very popular and are highly competitive. We also have a resident that's gone into critical care fellowship, a vascular fellowship, thoracic fellowship. But most importantly, you'll see that 2 of our residents have decided to go into private practice. So what that means is that after a resident is able to complete our program, they feel comfortable enough to go into private practice and to begin work right away. This is a list of some research opportunities that are available for you while you're here as a resident. And this is a list of what last year's residents did as far as publications and research presentations. The Department of Surgery is extremely supportive of research presentations, and anytime a resident has an oral presentation accepted at a regional or national meeting, the Department of Surgery will support that resident by paying their airfare, their travel, and their registration such that they can give that presentation. And these are some notable awards that our recent residents have achieved. You'll note that a surgery resident is currently the president of the DMC Resident Council, and we've also received several notable research awards. And here's a photo of some of our recent residents. Thank you for listening to this presentation, and we look forward to our interview time together. Thank you.